Welcome to my audiences. I'm glad to be back with another topic and, of course, another excellent expert with us. As you can see, Dr. Foteini Chouliara is with us. So thanks a lot. It's been great to have you back because I remember it was more or less a year ago that you had a webinar with us. So welcome back. It's been a while, but I'm glad that you were able to join us. How are you feeling tonight?
Well, I'm very well. Thank you, Caroline. Thank you so much for your kind invitation. And it's really lovely to be back amongst your company.
Definitely. We are happy to have you back as our presenter. And as you know, today we will talk about day 3 embryos and whether to transfer them or not. And of course, we have our expert to explain what's the best option. And of course, after that, there will be a time for questions. So remember, if you have them prepared, you can put those in the chat section right now or later on so that Dr. Chouliara can help you out. And let me just add that Dr. Foteini Chouliara, she's the gynecologist fertility specialist at Assisting Nature Clinic, which is located in Thessaloniki, Greece. So we are connecting with Greece tonight. I hope you are ready to start with our presentation. But before that, a few words I would like to say. Again, I would like to say thanks to Phenomatch, who is supporting European Fertility Society. And this is a great tool. You can have a look. We had some webinars on this particular topic. So this is something that you are interested in. I can only encourage you to have a look at this. And also, once again, as always, I want to remind everyone that we are still looking for volunteers. So if you or you know someone that might be interested and would like to help us with transcriptions, this is what we are looking for right now. Please get in touch with me. My name is Caroline, and I'll be happy to give you some more details as well. And support. You can also support us by donating. And if you go to myivfss.com, this is where you can do that. So anyone, if you feel up for it, then go ahead and check our website, of course. And we will be very, very happy and, of course, able to even to offer even more options, and we'll be happy to explore our everything that we can to support anyone that is struggling with infertility. Of course, that's why we are here. And tonight, let's go ahead. This is time for your presentation, Dr. Foteini. So you can start sharing your screen, so we can show you. And thank you. It's great to see someone from Colombia. Thank you. Welcome. And of course, remember that there will be a time for your questions later on. But now let's start with the presentation. Yeah, you can put it in full screen. Yeah, now everything is perfect. We can see it. So let's go ahead.
Okay, perfect. So thank you so much, Caroline, for this lovely introduction. So as Caroline said, today's topic is day 3 embryos, and really to transfer or not to transfer, here is the question that we will try to answer by the end of this session. So let's start a little bit from the basics. So let's see what's happening in nature at the point after ovulation. So as soon as ovulation occurs, the oocyte is being released by the ovary and is being picked up by the fallopian tube. And then it's passively moved along it towards the uterus. Now, if sperm is there and the conditions are optimal, then fertilization will occur. The embryo at first will consist of a single cell called the zygote, and then through a series of divisions, it will develop into a 2-cell organism, a 4-cell organism, an 8-cell organism, and so on, as it will be passively moved along the fallopian tube. So we can see that the embryo will spend the very few first days of its life inside the fallopian tube. Now, by day 4 or 5, the embryo will enter the uterine cavity. And by day 5, if everything goes well, it will form a blastocyst. On day 5 to day 6, the embryo will hatch out of its protective layer, the zona pellucida, and hopefully it will start the implantation process. Now, this is what's happening in nature. What's happening in the IVF setting? So the equivalent event to that of ovulation is actually the triggering shot and the oocyte pickup. And in IVF, instead of the fallopian tube picking up the oocyte, it's actually the fertility specialist that is picking up the oocytes and then is safely passing over the oocytes to the safe and highly skilled hands of the embryologist. The embryologist then will handle the oocytes, strip them, fertilize them, and then place the fertilized eggs into highly designed culture media and state-of-the-art incubators to allow the embryos to develop and culture further. So, when it comes to the embryo transfer, which is actually the return of the cultured embryo or embryos back into the uterine cavity, I mean, this can take place at any time after fertilization. It can take place at day 2 up to day 6 of the embryonic development, but usually it takes place either on day 3 or day 5. And these days are not picked out in random. They are special dates because the embryo reaches special stages of its development, and it's also the time when we can grade the blastocysts. So, a day 3 or a cleavage stage embryo consists of 4 to 8 cells. It's still enclosed in its protective layer, the zona pellucida, and it uses the energy and the chemical components provided by the egg in order to reach this stage. On the other hand, a blastocyst is a much more developed embryo. It's highly differentiated. It consists of a lot more cells, which are organized into the inner cell mass and the trophectoderm. The inner cell mass is a group of cells that are going to give rise to the embryo, and the trophectoderm is the outer layer of cells that is going to give rise to the placenta. Now, unfortunately, although almost all embryos can reach day 3, only a third or half of the embryos can actually develop into a blastocyst. And this is because blastocyst formation requires genomic activation for further growth and differentiation. Now, a little bit more about grading that I mentioned before. Now, um, as I said, embryo grading takes place at day 3 and day 5, and it is a means of selecting those embryos that have got the best implantation potential, and we transfer those first. Now, for a day 3 embryo, we're looking at the number of cells. We're looking at the symmetry of those cells and the degree of fragmentation. So for a day 3 embryo, a very good grading would be that of 8A. Whereas in a blastocyst, we're interested into the blastocele degree of expansion. The blastocyst is the liquid part of the embryo, and we're also looking into the degree of compaction of the cells that make up the inner cell mass. And of course, we're looking at how tightly knit are the cells of the trophectoderm. So a very good quality blastocyst would be a 4AA or a 5AA blastocyst. However, we need to keep in mind that, embryos continue to develop and they change. And grading has got its own limitations because at the end of the day, it is based on morphological features, and it's like judging a book by its cover. So an embryo might look really beautiful, but in reality, it could be chromosomally abnormal. So we've talked about how the embryos are developing in nature, in vivo, and we've talked about how we expect the embryos to develop that way in vitro, in the IVF setting. However, this wasn't always the case. So at the beginning of IVF, like in the 1980s, this was really difficult to do so. It was really difficult to culture embryos after fertilization and achieve day 3 and or even day 5 embryos. So at those on those days, it was much more preferable to transfer the embryos as soon as possible after the embryo transfer, because there weren't the appropriate lab conditions that could sustain the embryonic development in vitro. However, over the years, things have changed, and of course, lab conditions have improved. And to that, the evolution of the culture media have attributed quite a lot. We have seen that, culture media uh, at first were handmade, they were made in house, but then they became commercial, and with the competition, we saw a great improvement both in quality control, in consistency, less contamination, and we had and nowadays we have a variety of culture media that can emulate in vivo conditions a lot better and can actually accommodate for the changing embryonic, metabolic, and nutritional needs. So at, nowadays we have culture media um, that can help our embryos to reach day 5 stage. At the same time, we've witnessed the evolution of incubators, which was very, very important as well. I mean, initially the incubators used were like a fridge with a single door, exposing all of the embryos in, changing environmental conditions, differences in gas flow rates, in temperature, exposing the embryos to light. And as you can understand, all these factors were really increasing the stress factors, and they were impeding the further development of the embryos in vitro. However, with the introduction of mini incubators with separate chambers, which could offer more stable conditions, and of course, nowadays with the time lapse incubators, which can additionally offer continuous embryo surveillance, we can have better laboratory conditions which improve the embryo traits and can also offer us more information in order to improve our embryo grading and to improve our prediction of those embryos that have got better implantation potential. So, and of course, to improve live birth rates, which is the ultimate goal. So, having all these things in mind, all this information in mind, when we're considering when to transfer our embryos, I mean, having, highly designed culture media, having very good, top quality incubators, having high skilled embryologists. I mean, there is no room to consider any other way or any other time that we should go ahead with our embryo transfer other than the day 5 embryo transfer. And I mean, most of the studies and reviews and Cochrane reviews have shown that a day 5 embryo transfer is superior to any earlier embryo transfer. And that is for many, many reasons. Well, first of all, it allows for better selection of viable embryos, which have, might have looked similar even on day 3. It also allows us to transfer less embryos back into the womb and even do single embryo transfers, minimizing the risk of higher order pregnancies and all the obstetrical and neonatal complications that go along with it. For normal responders and for couples with good prognostic factors like young age, good quantity, good quality embryos, this really comes to no expense where pregnancy rates are concerned. Additionally, by transferring on day 5, we have a better synchronization of our embryos with the endometrium and the implantation window. And at that period of time around day 4 and day 5, even the uterine contractility is reduced, which favors our embryo transfer and allows for our embryos to stay exactly where we've placed them when we perform it. So by transferring higher implantation potential embryos, we see that we have increased our implantation rates, which in turn means increased pregnancy rates as well as decreased early pregnancy losses, which is very important as well. Now, another reason to transfer on day 5 is that of transparency. When we're allowing our embryos in an extended culture, when we allow them to grow further and reach day 5, we make sure that we can offer our couple the embryos of the best potential possible. Okay, so that's transparency. And at the same time, if the embryos do not reach the blastocyst stage, we avoid any, futile and unnecessary embryo transfers, and so save our couple from unnecessary heartache and pain. It's also very, very useful for diagnostic purposes, especially in couples with repeated implantation failures. So we can recognize those couples that for some reason, the embryos that they form are not competent enough to reach the blastocyst stage, so that we can explore other therapeutic options sooner as we're, moving along the journey towards parenthood, and could actually give a reason why, as to why their attempts are failing. A day 5 embryo transfer looks fantastic. It's got so many advantages. Are there any drawbacks? There are two basic drawbacks in a day 5 embryo transfer. The first one I already mentioned is the fact that we do have a higher cancellation rate, and although it helps us to avoid unnecessary embryo transfers, on the other hand, it could have a financial impact on the couple as well as psychological add-on and add on to the psychological stress that the couple is experiencing. And of course, in order to perform a day 5, an extended culture and a day 5 embryo transfer, we do require experienced and skilled embryologists, and of course, to culture the embryos in a state-of-the-art lab. So, isn't there any room for a day 3 embryo transfer? Well, a day 3 embryo transfer is not such a bad idea if we do come across, poor laboratory conditions. Okay, so in that case, if this is the case, then it's much better, it's more preferable to transfer early, even though we are placing an embryo not in the appropriate environment. A day 3 embryo should be in the fallopian tube, not in the uterus. So we are exposing it into a more sort of adverse environment, but it's a lot better than leaving the embryo in suboptimal lab conditions, and probably leaving very good day 3 embryos go to waste that way. Another group of patients that maybe a day 3 embryo transfer is not such a bad idea is for couples where we have fewer embryos available for transfer, such as for couples who are going through natural cycles, poor responders, or have advanced maternal age. So by leaving these embryos to culture further, we do not have any additional selection advantage. Okay, and in these cases, we need to bear in mind that we usually need to transfer more embryos in order to uh, to counteract the fact that unfortunately not all of them have blastocyst potential. So, thinking of the things that I've mentioned so far, deciding when to transfer is not always a straightforward answer. There are many factors that need to be taken into account, like the embryo quality and the embryo grading, the embryo quantity, how many embryos do we have available for transfer, the couple's particular circumstances, like the patient's age, the couple's history, the risk of multiple pregnancies, and, very, very importantly, what are the current lab conditions available? So, taking all those factors into consideration, we can make an individualized choice of when to transfer, which is really a joint decision with, amongst the couple, the treating physician, and the embryologist. Okay, so thank you so much for your attention.
Thank you so much indeed. Great to have you back, definitely. Thank you for explaining and walking us through all the, sorry, I lost the word, through walking us through the every aspect of embryo transfer on day 3 as well, of course. And now it's your favorite time because it's time to ask some questions. So, Dr. Foteini, are you ready for some questions?
Yes, of course.
Brilliant. Thanks so much. Then let's go ahead. Let me just, here's the first question from Christina. I had just had frozen embryo transfer of 2 day 3 embryos, which failed. They were 10 cells each, grades 1 and 2. They were frozen. I was 41. I am 42. Do you think the failure was due to the embryos being abnormal? I have been advised to freeze the embryos on day 3 as I only had a few on retrieval. I have 7 embryos left, day 3 also. What would you recommend? Transfer 3 in one go instead of 2? Do you also recommend assisted hatching? Thank you so much for your first question.
Okay, so if I understood correctly, there were 7 embryos that were frozen on day 3. Is that right?
Yep, I see this. I have 7 embryos are left, right? So day 3.
Okay, well, initially, if we had so many embryos available, I think I would have gone for day 5 embryo transfer to start with. Okay, so I mean that way, we could have a better selection. So instead of choosing out of 7 embryos and doing repeated embryo transfers, I think it would have been preferable to leave them to day 5, have fewer embryos to transfer, but as we said in the presentation, with better implantation potential. So possibly, achieving our goal sooner rather than later. But of course, since they've been frozen at day 3, there are actually 2 choices. One of them is to transfer on day 3, and yes, I do agree, maybe go for 3 instead of 2 to increase your chances, or you could maybe thaw and leave them to grow to day 5 and transfer blastocysts rather than day 3 embryos. So that could be another idea. And as about assisted hatching, of course, of course.
You also use this at the assistant nature
Yes,
at clinic.
yes,
Mhm.
yes.
Okay.
Mm-hmm.
Actually, there will be a webinar next week on some IVF add-ons, so you can join us. And Evie, actually, also from Assisting
Yes.
Nature, will be able to explain all those additional techniques. And for
Right.
example, assisted hatching, I'm sure this will be discussed as
Mhm.
well. All right, and thank you from Christina. Thank you so much indeed. And let me have a look. There's one more from Christina. Is it anything I could do? I did hysterectomy already to increase my rates of success.
Yes, I think it's a very good idea, especially if we've had a failure. Okay, because I mean, there are some uterine abnormalities that are very, very subtle. They can be a little bit difficult to be picked up just via ultrasound alone. So it's a good thing that you did hysteroscopy, that you did, Christina, hysteroscopy as well. And of course, since every embryo is so valuable, have all the other aspects well regulated, like the thyroid, vitamin levels, and any other health problems, sorted and regulated before your embryo transfer.
All right. Thank you for answering the next question as well. Okay, let's have a look. In a patient with low ovarian reserve and poor response, follicles only three follicles, only one mature, reaches day 3. Do you recommend to transfer or wait until day 5, I guess, with the possibility of losing it? What
Yes. Yeah. I mean,
implantation?
yes, I think these are the difficult decisions because you're faced with the fear and the insecurity of not having an embryo to transfer. So, if this is something that you cannot handle, then do a day 3 embryo transfer for sure, mostly for psychological reasons. But if you discuss it with your physician and you know the pros and cons, maybe it would be worthwhile to try it and leave it to reach day 5. And that way you can actually test the competency and the potential of your embryo. But of course, in order to do so, as I mentioned earlier, you need to have excellent lab conditions so that if the embryo doesn't reach day 5, it's purely due to its lack of intrinsic competence and not due to any external factors.
Brilliant. Thank you so much indeed for that answer as well. Claire has another question, so let me show you. I had 6 embryos that were not good quality, enough quality at day 6, none to transfer. Would you have transferred at day 3?
So the embryos were left for day 6,
Yep,
but they,
not
they
to
were
transfer.
deemed and they were deemed not good enough for an
Yeah,
embryo transfer.
yeah.
Yes, I mean, yet again, if the lab conditions are good, and this is always checked by the performance indices that every lab has, then I think it was a good idea that you didn't transfer on day 3 because these embryos would never have implanted. So I mean, it's a risky business leaving them to day 5. It can
Yeah.
be a bit disappointing, but at least you can see, what's happening in front of your own eyes, and you can see why this embryo transfer wouldn't have worked
Right.
because the embryos, unfortunately, they didn't manage to reach the blastocyst stage.
All right. Thank you. And as a follow-up, actually, you talked about excellent lab conditions. How do you know if your clinic has excellent lab conditions?
Oh, yes, that's true. Well, this really, there are different, performance indices that every lab needs to have and needs to meet. So, I mean, you can ask at your clinic, like the fertilization rates and the blastulation rates. So you can have some insight of how things are working. But
Brilliant.
but generally, this shouldn't really be a question that you ask your clinic. It's a question, that the clinic itself is asking itself. So it's, maintaining high qualities of care and a high, lab standards. So every clinic should really look into these indices itself and improve on itself. And every physician knows how strong, a lab is. And I think this plays a very important role in deciding on whether to advise the couple to go for a day 3 or a day 5 embryo transfer.
Brilliant. Thank you so much indeed for once again for an answer. Okay, we talked about blastulation rate. So what could cause poor blastulation rate?
Well, it's the embryo itself. As we've said before, it's not easy to become a blastocyst. I mean, the activation of the genome has to take place, and it needs to work right. So that's the combination of both the maternal and the paternal genes. And if this works, then yes, we have blastulation, and the embryo has the ability to differentiate into what we call the blastocyst. Now, becoming a blastocyst, however, doesn't mean that we're going to have a live birth. But it's another step into the embryonic development that the embryo can take along the way.
Okay, thank you, Rosalind, for your question. There are two questions from Karen. So, what type of abnormalities are difficult to detect through ultrasound but could be detected through hysteroscopy?
Yes, I mean, it could be subtle abnormalities like a polyp, or maybe a small submucosal fibroid, or even a septum. Small septums are usually missed on gynecological ultrasounds, even in 3D ultrasounds. So, I mean, hysteroscopy still remains the gold standard in the evaluation of the endometrial cavity. If it was, cheaper, if it wasn't that expensive and a little bit invasive, all couples should have a hysteroscopy, before any embryo transfer.
All right. Thank you so much indeed for that. There's one more from Rosalind. Thank you for the presentation. Would you take all embryos to blastocyst stage irrespective of the grades? Also, what is an ideal blastilation rate?
Yes, I mean, if we decide to go for a day 5 embryo transfer, yes, leave all the embryos to test them and see, the fittest will become a blastocyst. So yes, leave all of them. And a good blastilation rate, this is up to the embryologists. But it should be, I think, above like 30%, 40%.
Thank you for the clarification to this question as well. Hope that was helpful. And now a bit of a longer question. I'm 43. I have 4 embryos left. 2 of mine which have fragmentation, and 2 donor embryos, all of which have been frozen at day 3. All of my previous transfers have failed. 2 with my embryos and 1 with donor. My clinic pushes 3-day transfers, but at this point I'm thinking to thaw and try to push my remaining embryos to day 5. But I fear I will lose them all. Should I attempt to push them to day 5? I've just completed an ERA and have a hysteroscopy scheduled to make sure there are no issues.
Okay, so we have like 2 of our own embryos and 2 with donor.
Yes, 2 donor embryos.
Okay, so we're looking at 2 separate embryo transfers, one with our own, first of all, and then I guess with the donor. So, I mean, in this case, maybe there isn't an advantage to grow them to day 5 because it's not going to help us to select, one or the other. If you only have 2, both of them are going to be transferred. The only thing that we're going to miss out is whether these embryos were good enough to become blastocysts. So if everything works out and you become pregnant, we don't really mind. But if there is a failure, then it would be a very important information to know when we're asking ourselves why we failed. Okay, so it's mostly for diagnostic purposes rather than using the day 5 culture to select amongst the embryos.
All right. Thank you for your question again. Hope that was helpful. If there's anything else, please type this in the chat, of course. And let's have a look, okay? What is your take on day 6, 7 blastocysts?
On day
6 or 7 blastocysts?
Okay. Okay, this puts me in an awkward position because, under sort of, how can I say? I mean, an embryologist can maybe answer this better than me, but if the lab conditions are optimal, embryos should reach the blastocyst stage by day 5. By day 6, it should be ready to hatch. However, if the lab conditions are a little bit different, it might take a little bit longer for the blastocysts to reach this stage. But I'm afraid by that time, we will have lost the implantation window. So I think it's better to transfer on day 5 or day 6 at the latest.
No, not longer than 6 tops, right?
Yes.
Okay.
Yes.
Thank you for the clarification. Okay, might be our final question. So, of course, if you have more, you know what to do. Go ahead, type those in. And the question is here. We had 9 donor eggs, of which 7 fertilized, but only 1 made a good blastocyst to embryo transfer day 5. I wonder that what could cause only 1 embryo to progress to day 5. The donor was 25. That 1 blastocyst was of good quality.
Oh, I see. That's quite a big hit because when you're going for donor eggs, you're expecting better results for sure. I mean, the egg quality is the most important thing, but sperm quality is equivalently important. So I don't know how was the sperm parameters, because sometimes when the sperm parameters are poor, regardless of how good the donor is, we do get bad blastilation results.
That makes perfect sense. So if you wish to add anything, go ahead, type this in. If not, we will be slowly finishing. So thank you. I guess that we have all the questions answered. But of course, remember, I know for sure that if you wish to ask, you can definitely get in touch with Dr. Foteini and her
For sure.
team at Assisting Nature. I'm sure they will be able to help you out with even more details. As always, this is a webinar. You can learn a bit, but I guess it's always best to have a consultation just to get some answers more precisely. Okay, we will be finishing for tonight. Thank you so much, everyone, for joining. I believe it was helpful for you. This is definitely a topic that comes back quite often. I know that this many times we hear day 5 embryo transfer. But I'm glad we were able to discuss this tonight as well. Dr. Foteini, great to have you back. Before we finish,
Thank
anything
you.
else you wish to add?
Well, thank you so much. It's been lovely once again. Hopefully, my presentation was helpful to our patients, to our couples. I hope that I might have answered some of their questions. And of course, if they need anything further, me and our team, we're at their disposal.
Brilliant. Thank you so much indeed. And I already mentioned that we will have another team member from Assisting Nature. Actually, next Tuesday, you can join us. We will discuss embryo glue, but also assisted hatching and embryo monitoring, etc., etc. So please join us. We will be back with Evie Timotheo. She's also from Assisting Nature. It's your colleague, of course. So we are happy that we will have one more member from Assisting Nature. So you can sign up already. Of course, you will find it on our website. And once again, we like to say thanks to Fi Inomach, who is supporting European Fertility Society. And that is it for tonight. But of course, as you know, we will be back with some more topics, with some more interesting and excellent experts like we had today. So don't hesitate. I hope to see you very soon. Dr. Foteini, again, a great pleasure to have you back. And I'm already looking forward to some more events for sure. Have a great evening, everyone. Okay, take care and see you next week as well.
Okay,
Bye.
thank you.
Thank you.
Bye-bye.
Bye.